So a number of you guys have been asking me for OSCE tips since end of block OSCEs are approaching, because there are quite a number of few things that they don't tell you about how you are being assessed until you actually go through the OSCE. I'm a fifth year medical student at Stellenbosch, which means that I have completed about 4 clinical OSCEs on a real patient in the hospital. So I have quite a bit of insight into what the examiner expects of you, especially because I am someone who doesn't like to make assumptions. I have requested feedback for all my OSCE just to get a bit of insight into the examiner's mind so that I know where I went wrong and how to fix it and be better next time. So the first tip, which is something I wish I knew honestly before entering an OSCE, is that one of the requirements is for you to be able to pick up the clinical signs or answer all the questions correctly the first time around without being prompted or guided by your examiner, right? But if you miss the clinical sign or fail to answer the question by yourself, then the examiner will prompt you or guide you towards the right direction to see that you are able to pick it up with guidance. And if you do, then you get a score of 40 to 45% for that section, which is the minimum mark you need to qualify for entrance to a supplementary exam, should your overall mark for the OSCE be a fail. For example, in my pediatrics OSCE, right, I was able to pick up an enlarged liver, a distended abdomen in the patient, but when I presented my findings to the examiner, then she mentioned something about the spleen. And then I was like, okay, let me check again, because I didn't want to say I don't know because immediately she said that I knew that, okay, there's something happening with the spleen that I clearly missed, right? So now I palpate for the spleen again, only to find that it was also enlarged. And then she decided to give me a 45% mark for that examination section of my OSCE, even though I did pick up all the other signs. My overall mark for that PEDS OSCE was 68%. So I did pass it because I did pretty well with the other components of the OSCE, which is the history taking, the anthropometry interpretation, the differential diagnosis, the investigations, and so forth. But another section where I lost marks was actually the differential diagnosis section, which brings me to my second point. So tip number 2, it is important to know your theory and demonstrate good clinical reasoning. So like I said, with the differential diagnosis of that patient, right, I obviously listed TB abdomen, malignancy, HIV, and a few others that were appropriate. But then I lost the plot now when I said the patient might also have hepatitis. And then the examiner gave me a very suspicious look and then asked me, does your patient have jaundice? And then I look at the patient and I'm like, no. And then she's like scratching something like angrily on my mark sheet, and then I just knew, whoa, I just lost some marks here, because to her, me randomly giving a diagnosis that does not fit the patient's presentation means that I don't have insight or good clinical reasoning, right? So essentially she gave me half the mark for the differential diagnosis section, because guys know, for you to be able to get all your marks for good clinical reasoning, you need to be able to see the picture on the puzzle once you have put all the pieces together and be able to describe it accurately, right? So you can't just randomly say things that do not fit your patient's presentation, because to the examiner that shows that actually you don't understand what is happening in this case. So tip number 3, guys, you know what? Do not ever give an examiner the opportunity to interrupt you or stop you numerous times while you are giving an answer to whatever question they are asking you. I failed my surgery OSCE the first time I did it because I did not take control of my OSCE, and to the examiner, it made me to look like I don't know my work, right? So for context, one of the questions that the examiner asked me was my diagnostic approach to a thyroid mass. And then obviously I said, you first need to test their TSH, if it's low, you do a thyroid scan. If it's high, you do a ultrasound scan, right? And then I kept quiet, and then the examiner asked, and then, then okay, if the thyroid scan shows a hot nodule, then you treat as per hyperthyroidism. If it shows a cold nodule, then there's a risk of malignancy, therefore you do an ultrasound scan. And then I kept quiet, and then she was like, okay, and then what are your findings, or what are you looking for on the ultrasound scan? And then I proceeded to give my answer, and I answered everything correctly until he was satisfied. But he failed me for that section of my OSCE. Why? Because in his mind, he was assisting me to get to the answer. I was not competent enough to be given a pass because I needed a lot of help or assistance to get to the correct answer. Yeah. So this thing of saying that, examiners understand that you are nervous, blah, 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 is actually crap. They don't understand. You need to get your act together, and do the right thing and be professional, answer the right questions correctly the first time for you to be given a pass for your OSCE. Tip number 4, so when it comes to answering special investigations and management questions, guys, same as the previous tip, you need to know your theory very, very well. Because if you are going to mention anything, right, you need to be able to explain why you are choosing that test, or you are choosing to give the patient that specific medication, or do that specific clinical procedure or surgical procedure, or whatever case is part of your, whatever the case is, right? So once again, do not go into an OSCE unarmed. You need to study. You need to understand the theory of the work that you are rotating through. Another thing, guys, don't prepare for an OSCE alone. Team up with your colleagues who you are rotating through the rotation with, and identify, the conditions that the patients have in the ward or firms that you are currently rotating through, because those are the patients you are going to get for your OSCE. Also, practicing with a friend helps you to verbalize and learn how to speak medicine confidently, as opposed to just doing the OSCE practice alone, right? What I've realized is that sometimes what you think does not necessarily come out right when you have to say it. So this is one of the instances where actually practicing with a friend and discussing my findings with them has helped me to perform better in my OSCEs, and other than failing surgery, honestly, I've been able to pass all the other ones that I have done so far. And tip number 5, guys, which is not the last, there's actually quite a lot that I can go into regarding OSCEs. But one thing I can say for sure is that you need to practice your history taking and examinations very early on in the rotation, right? So that by the time your OSCE comes, it becomes almost like muscle memory to demonstrate these things on the day, right? So what I like to do, especially to help me develop my clinical reasoning better, is whenever I am seeing a patient in the hospital on a daily basis, I don't look at their folder. You know, I first do the history, I first take the history, come up with my working diagnosis, which guides me into knowing which clinical signs not to miss on examination. And then I examine the patient, think of the special investigations that I need to do, come up with a management plan, and then finally refine my list of differentials, and then compare my notes with what the patient actually has according to their file. You know, this has really helped me improve in my clinical reasoning, improve in, you know, my ability to think independently and to think accurately, and the way we are expected to reason, you know, in an OSCE, you know. So I try to do this like once or twice a week, you know. So guys, do not be in a rush, you know, to leave the hospital, especially on days where you have a little bit of time after your shift to stay another extra 30 or 40 minutes to practice your skills and examinations on a patient. So yeah guys, let me know in the comments, you know, what questions you have, what else do you want me to speak about, because honestly when it comes to OSCEs, you know, it's different per rotation, it's different in every rotation, honestly. So there's a lot more that can be said about how to prepare for them. Yeah, but if this is your first time on my channel, welcome. My name is Dawn. I am a 5th year medical student and I'm also a mom, and I make vlogs, especially on my short videos, especially on my short form videos, because I don't always get the time to make these sit down long form videos. So do subscribe and like this video, and also check out my previous videos that are related to this one. Yeah guys, so thank you for watching. I will see you in my next video. Bye.